My name is Matt Smith, and I am a physical therapist at Agape. I started Agape in 2001. I was a sophomore at UNI and got the opportunity to do some job observation and then became an aide and worked all the way through my undergraduate time at UNI and then went off to physical therapy school and then came back in 2007 to work, and I've been here as a physical therapist since then. Patients feel like they have a really private and one-on-one relationship with their therapist or therapist assistant, and I feel like that continuation of quality of care, of being consistent with the primary therapist or the physical therapist assistant, I feel like that works. That's a good team approach, and we have a very diverse clinical staff. All of us went to different schools. I feel like those type of skills that we learn that are maybe stronger at schools other than others kind of help bring all of us up because we're able to share that knowledge. I think it's important that Agape is involved in the community for various reasons. One, we obviously all live here and we want to better the community with a quality of health care, information we can provide to patients, to non-patients, even just regular citizens who maybe hear a wellness talk or hear different things that we maybe put out from letters and newsletters and emails. I think it's important for us to be able to integrate with our fellow neighbors so that we all can get better from a health standpoint. So we want our children and our grandchildren to all be able to have a better quality of life than what we have currently, and I think the best we can do is by sharing that information with them. Direct access is a legislative thing that has come across various states. I think most states in the United States are direct access states. It means you do not need a physician's referral for physical therapy. It's meant to decrease the amount of wait time for physicians. Maybe if you feel like you've had an ankle sprain, for example, and you need to, you have a pretty good idea of what you did and what you need to do, and it's just going to be another, copay at your doctor's office, or it's going to be additional day or two delay before you got to the physical therapy side of things. That allows the patient to be able to come to a physical therapist and assess. We have a number of patients that come in with direct access where they don't need their physician's referral. And patients appreciate the convenience of it. They appreciate the quality of care that they get from that as well. And I think that, from a therapist standpoint, I feel like we do a good job with educating the patient. If there's something that we see that is a red flag and we feel like we need to have that patient go back and see their physician, that's our assessment, and that's what our role is in that process. So it should still be an integrated process with physical therapists as well as the family physician and whatnot, but hopefully they don't have to necessarily see the physician to accomplish what they want. The relationships are kind of what I enjoy the most about my patients. I'm seeing them improve and function and being able to meet their goals and to meet their desired outcomes. That's what my role is, and it's to help them get to that point. And so it's fun for me to be able to see patients come in and maybe not fun that I see them on that first day and they're in pain, but hopefully by the time that they're all done, they've made a lot of progress and they feel better, and then I can see them out on the trails running or biking or at a sporting event or whatever. And it's just nice to be able to kind of build that, and you have a great sense of satisfaction because you're able to accomplish those things with the patients.